Senator Baldwin, you are recognized.
Thank you, Madam Chairwoman. Like so many of my colleagues, we're very much looking forward to hearing from the FDA later today. But we all know that we have a lot of work to do. We still need to wear our masks. We still need to limit our gatherings until at least 70% of Americans are vaccinated. And to get there, our states are going to need support. I want to share that in hearing from Wisconsin officials, they've been working overtime to provide care to patients with COVID-19, reduce the spread, and prepare for the vaccine distribution. But the state estimates that they will need an additional $10 million for vaccine infrastructure readiness over the months to come. States are doing as much as they can to get ready, but they can't do this work alone, as we all know. And I'm concerned about the potential for breakdown in coordination between the federal government, states, and partners in the private sector. We've got to get this right from the very start. So Mr. Wheeler and Mr. Smith, given your roles in the distribution process, can you describe which points in the distribution coordination will be the most critical and where you see the potential for breakdowns? What do we need to do to ensure better coordination at these various points?
I think what I would ask is that the state jurisdictions that are working with Operation Warp Speed come up with a very good forecasting model. As soon as we can see that the volume coming through the pipeline and through the system, the better. I think that's probably the best way to answer it. We are taking orders from McKesson and Pfizer for these two vaccines that come straight in. We have embedded employees at their locations, so we're scanning everything from the origin to the final destination. And Operation Warp Speed is really driving the train here. They're the ones giving us the orders to move.
Yeah, and I would just second that. I mean, we feel very confident, as I know UPS does, about our role in this, particularly the transport from point A to point B. We don't decide where the vaccines go, how much is allocated to each state, how it's allocated within the state. We're the transportation provider, and our mission is to get it there rapidly and reliably, safely and securely. But we're very confident about it in our system. There are certainly things before it enters our system that are outside of our control. There are things after we deliver it that are outside of our control. But I'm confident about it when it's within our control, and I'll just echo what
I might add that it's very useful to have CVS and Walgreens signed up as really the primary destinations, at least for these first few months. That's very helpful because both companies know CVS and Walgreens very well. We have all the addresses we deliver every day for all sorts of things. So having that focus is very, very important to the supply chain, I believe.
Thank you. Dr. Levine, I'd like to ask you about dry ice, especially given its essential role in delivering the Pfizer vaccine doses. Pfizer has developed plans to secure access to dry ice for their initial shipments. But I'm wondering about the second phase of dry ice demand, when Pfizer shipping containers are replenished with dry ice at the state and local level. I understand that it is state and local health leaders or whoever receives the shipment within the state who are responsible for ensuring their supply at that point. This is all happening at a time of heightened demand for dry ice around the holidays and in an industry that operates in a just-in-time basis, given a short window to use dry ice after it's manufactured. Do state and local leaders who anticipate receiving a shipment of Pfizer vaccines have clear and robust information about how and where to source dry ice that's needed for the replenishment and adequate cooling of the supplies that they are likely to receive?
So yes, the Pennsylvania Department of Health, working with PEMA, the Pennsylvania Emergency Management Agency, would be able to obtain dry ice if necessary. For the first stages, we actually don't anticipate it'll be necessary because, again, the Pfizer vaccine will be going to hospitals And particularly that vaccine will be going to hospitals that have themselves the refrigeration capacity to be able to keep it at the ultra cold storage temperature that is necessary. And then for the long-term care facilities, as was mentioned, it's going to distribution centers at CVS and Walgreens. And those centers also have the refrigeration capacity to be able to keep it at an ultra cold temperature. Now, with future distributions, as it goes more out to FQHCs and et cetera, we're going to be able to really try to work that they can be administered, right when the box is open, and we can administer that amount of vaccine. I think the Moderna vaccine, which has less requirements, will be much easier to distribute, as I mentioned, to rural Pennsylvania and other parts of Pennsylvania that won't really have access to those refrigeration capacities.
Is there any information that you would like to be made available by the federal government or through cooperation of the industry to ensure that local health officials have a clear direction on dry ice sourcing protocols or alternative sourcing plans if needed, and pricing? Any sort of dashboard that should be required?
Absolutely. I think what we've shown is that it is really challenging when the states are almost competing with each other for needed resources. And that occurred in the spring, particularly for personal protective equipment. Since we know that every state in the country is going to need this material for the eventual distribution as time goes by of the Pfizer product, it would be helpful if the federal government coordinated that and we didn't have to bid against our sister states.
Thank you.